Hey guys, I'm Lexie Mower.
And I'm Carly Niemann, and this is our presentation on increasing range of motion of the elbow considering optimal patient positioning during an ultrasound treatment.
So a little background on ultrasound for you. An ultrasound treatment uses inaudible, high-frequency vibrations that produce a heating or non-heating effect to treat acute and chronic pathologies. Ultrasound provides an added blood flow to the area to increase healing extensibility. Correct ultrasound parameters for ultrasound treatments are important to ensure the patient is receiving the most effective treatment possible. Ultrasound promotes a wide range of physiological effects such as tissue regeneration, bone healing, pain modulation, increased blood flow, decreased pain, and increased range of motion.
Previous studies on the topic have found that ultrasound treatment increases tissue extensibility and improved joint contracture. The joint may be experiencing a decreased range of motion due to a contracted joint capsule, an injury to the surrounding ligaments, or a buildup of scar tissue. The stretching window that we are referring to is the length of time post-ultrasound treatment where the tissue is optimally heated for improved stretching. Some previous studies have stated that the stretching window can last up to 10 minutes, while others say it only lasts up to 3 minutes.
So why is our study significant? Well, you might ask. Well, currently there is minimal evidence supporting the idea that applying a stretch to an ultrasound treatment before the drop in tissue temperature increases the range of motion. This study compares ultrasound treatments performed with a patient in a stretched position to an ultrasound treatment with the patient in a relaxed position, and just looking at which one is going to have the greater effect on the range of motion. We hypothesize that range of motion of the elbow will have a greater increase during the ultrasound treatment delivered while the patient is in a stretched position.
And the photo on the bottom of our presentation is showing that stretched position. The patient has a weight in their hand while the ultrasound is being delivered to their elbow joint. And the relaxed position is going to look similar, except the patient will not be having a weight in their hand.
So our participants are a convenient sample from here in the AT program at the University of Montana of 7 healthy adults that were selected for the study. Our procedures is going to be a repeated measures design was used where subjects completed 2 separate trials with a week between each trial so that the 2 treatments were not affecting each other. The 2 trials included vigorous heating ultrasound treatment for 5 minutes on the subject's right elbow when the patient was either in a stretched position or a relaxed position. Elbow extension was measured with a standard 12-inch goniometer before and after each trial. 3 measurements were obtained and an average was recorded to take out human error. The treatment order was randomized and spaced out over a week to take out bias. For data analysis, Microsoft Excel was used to calculate descriptive statistics for each participant's height, weight, and age along with elbow extension. A 2x2 repeated measures ANOVA using SPSS was used to calculate the mean difference between the stretched and relaxed position trials. Significance was set at priori. So a 2x2 repeated ANOVA resulted in no statistical difference between the resting and stretched positions while delivering the ultrasound. However, there was a main effect for time where both trials demonstrated improved elbow extension and range of motion. A follow-up trial comparison demonstrated statistical significance of p equals 0.003, so not quite hitting that p equals 0.05, where the stretch trial on average improved elbow range of motion by 1.5 degrees more than the resting trial did.
So the takeaway from our study showed that there was no statistical difference between the relaxed and stretched positions while delivering ultrasound treatment. For all participants, both positions did produce an increase in elbow range of motion with vigorous heating. However, it is unclear if the ultrasound treatment itself is the cause of that or the gravity-dependent position that we had them in, and if that influenced the joint outcome. So while looking at our limitations of our study, we thought some future research could be done. And our ideas for that are that the study should include subjects who do have current elbow injuries and working on restoring that range of motion. Other joints such as the ankle or the knee would also be good for this study. And studies can also manipulate the amount of weight or resistance they're applying to that joint. We used a 3-pound weight. You could go more than that, go less than that. And the study could utilize joint mobility movements rather than the isometric hold, which we did with 3-pound weight.
Thanks, guys.
Thank you.